Welcome to our channel Nursing Tutorial. Important nursing question and answers with explanations. Question number 1. What is the most appropriate position for administering enema? Answer is B. SIMS position facilitate better flow and retention of enema solution. Question number 2. Which instrument is used to measure blood pressure in infants? Answer B. Appropriate cuff size is essential for accurate infant BP measurement. Question number 3. What is the normal range of fasting blood sugar? Answer B. Values above this range suggest impaired glucose regulation. Question number 4. Which site is preferred for subcutaneous injection in adult? Answer B. Abdominal subcutaneous injection allow consistent absorption and easy to access. Question number 5. Which nursing action is most important when administering oxygen therapy? Answer A. Proper tubing placement prevents discomfort and maintains effective delivery. Question number 6. What is the normal glomerular filtration rate in adult? Answer is B. Glomerular filtration rate indicate kidney function values less than 60 suggest renal impairment. Question number 7. Which of the following is the early sign of hypoxia? Answer is C. Restless and altered mental status are the early signs. Cyanosis appears later. Question number 8. The best site to check pulse in an unconscious adult is? Answer C. Carotid pulse is strong and accessible for quick assessment in emergencies. Question number 9. Which of the following vaccines is contraindicated in pregnancy? Answer C. MMR is a live vaccine. It is contraindicated in pregnant women. Question number 10. What is the antidote of organophosphorus poisoning? Answer is B. Atropine reverses cholinergic effect of organophosphates. Question number 11. In which position should a patient be placed during lumbar puncture? Answer is C. The flexed position increases space between vertebrae, facilitating needle insertion. Question number 12. What is the first action in a case of fire in a hospital? Answer C. Follow raise, rescue, alarm, contain and extinguish or evacuate. Question number 13. Which electrolyte imbalance occurs in vomiting? Answer is B. Potassium is lost in gastric secretion leading to hypokalemia. Question number 14. What is the normal range of serum sodium? Answer is B. The normal serum sodium level is 135 to 145 MCQ per liter. Question number 15. A patient with tuberculosis should be placed under which precaution? If you know the answer, comment in comment box. Thank you for watching my video. If you want more videos, please subscribe my video. Thank you.